London in the UK, and the Royal College seeks to improve women's health through education and training and establishing guidelines for best practice in women's healthcare. And we now have over 14,000 members worldwide. There are huge challenges for women's health in conflict. It's estimated that there are 1.5 billion people affected by conflict or by living in countries that are fragile or are affected by large-scale violence. And with the disruption in social and healthcare infrastructure, overcrowding services that we've already heard about this morning, competing priorities, women's health often is overlooked. And there are particularly vulnerable groups within women's health, such as adolescents, and we've heard a little bit about that, those that are pregnant and those that are disabled. And yet all women people have a right to reproductive health, and it's defined here. Complete physical, mental and social well-being in all matters related to the reproductive system. And that includes being able to regulate fertility. It also includes being able to access maternal and newborn care. But that requires access to high-quality information, and to high-quality services that have been developed with the community, so it's based on real needs and respects religious and cultural backgrounds and promotes informed choice. And we've heard already today about why women's health is vulnerable in crises. Partly it's the low social status of women, so women are unable to negotiate their health needs. Women are frequently targeted in acts of violence. Women and children account for 75% of those that are displaced in conflict. 20% of those will be of reproductive age, and 1 in 5 of them will be currently pregnant. In addition to that, women lose access to family planning, sexually transmitted infection becomes more prevalent, and the hygiene needs of women and girls is often neglected. And all that leads to a rise in maternal mortality and morbidity. So the priority's got to be to save lives and prevent morbidity. But how do you do that in the face of a crisis, in an emergency situation? What services do you target to prioritise? I think the approach is very much that of the minimal initial service package, or MISP, which was developed by an interagency group working on reproductive health in humanitarian crises. And they produced a field manual describing those minimum interventions that need to be put in place as a priority at the start of an emergency, and then at the same time planning for comprehensive reproductive health services as soon as possible. And these are the specific interventions that need to be introduced at the start of an emergency. Maternal and newborn care, so that includes emergency obstetric care, family planning, gender-based violence services, and the prevention and treatment of sexually transmitted infections. At the same time, starting to plan for comprehensive care. Obviously, it's essential to have the right drugs, equipment and supplies at the onset of an emergency, and the interagency group therefore developed pre-packaged reproductive health kits to support those initial interventions. They are designed to serve populations of different sizes for the first initial 3 months of an emergency. And so you need details of the population you're serving and a distribution plan when they're ordered. Now, I had a video to show you about MIS, but I'm not sure that it's going to work. No, okay, I'll skip over that. We know what kills pregnant women. The top 5 direct killers are hemorrhage, sepsis, abortion, hypertensive disease, and obstructed labour. And I just want to draw your attention to the fact that 15% of global mortality is caused by abortion. That includes both spontaneous abortions, so miscarriage, and unsafe induced abortion. And in some countries and in humanitarian settings, that figure is often a lot higher, and I'll come back to that in a moment. We know that 15% of pregnant women will encounter a life-threatening obstetric complication, and that leads to 170,000 deaths in humanitarian settings every year. So providing both basic and comprehensive emergency obstetric care functions is essential, but these need to be available 24 hours a day, 7 days a week, and you need a means of transport to reach an appropriate facility. Abortion. I've already alluded to the fact that it contributes to maternal mortality. In fact, 5 to 6 deaths every hour is due to abortion, to the complications of abortion. And that may be complications of miscarriage or of unsafe abortion. And women are at increased risk of unplanned pregnancy in humanitarian settings for some of the reasons shown here. And making pregnancy safer includes providing safe abortion to the full extent of the applicable law, and also to ensure post-abortion care for those that get complications as set out in the WHO technical guidance of 2003. Post-abortion care is a global strategy to reduce deaths and suffering as a result of abortion, and it involves the treatment of complications of abortion, addressing the psychosocial needs of those affected, ensuring post-abortion family planning, and then forming partnerships with the community to prevent unwanted pregnancy and unsafe abortion. Comprehensive abortion care includes all those elements, plus making abortion safe for all legal indications. If you're talking about prevention of maternal mortality and morbidity, one of the most effective public health interventions is family planning. And yet there's an unmet need globally for family planning that affects 225 million women in the world. And the need is greatest where maternal mortality is highest. And look how many of these apply to humanitarian settings: adolescents, migrants, those living in urban poverty, refugees, and women in the postpartum period. And family planning makes economic sense because this is in UK money, but for every £1 spent on family planning, you save £11 from having to treat complications of pregnancy. So it makes economic sense, and it has the potential to really improve women's health. So in terms of family planning in conflict situations, it's important to try and continue the methods that are already in use, as well as making condoms widely available in a manner that's culturally acceptable. And then as the situation stabilises somewhat, it's important to try and introduce high-quality family planning counselling with a range of methods available, ensuring that you've got trained staff and sustainable supplies. Another major public health concern is sexually transmitted infection, and failure to diagnose and treat quickly can have severe consequences for the next pregnancy and even life-threatening consequences, both in the short and long term. Conflict increases the risk of STIs. So it's important to think about prevention and then to ensure prompt and comprehensive treatment for infections, following a syndromic approach according to local protocols, remembering partner management. And of course, for those that are HIV positive, continuing ARVs for those already on medication. I just want to make a special plea for adolescent sexual health. They form a large percentage of the population and the displaced population. They have probably a higher unmet need for contraception than even adults. They're a particularly at-risk population in humanitarian settings. And it's important to remember they are the future. So we need to overcome the barriers that prevent them from accessing services. And that may be individual, social, cultural, or structural barriers. And of course, it's important to think about planning comprehensive reproductive health services. These services are going to focus on the same areas as the initial interventions, but also take into account other gynecological care and gynecological problems that really affect quality of life for women and may contribute to mortality. Obviously, to plan for comprehensive services, you need background data, you need to know about your maternal mortality rate, you need to know about your contraceptive prevalence, you need to know about your reproductive health knowledge and behaviour of the population you're serving. You need to identify suitable sites, and you need to ensure that your staff are trained and that you've got equipment and supplies. And just to finish, I want to mention a new project that the Royal College is developing at the moment. It's called Essential Gynecology Skills Training. And I'm just wondering if this could be helpful as a means for training in comprehensive reproductive health care. The rationale for EGS, as we call it, is that there's a huge burden of gynecological disease that's unaddressed and borne by women. And just as an example, there will be more deaths from cervical cancer this year than there will be from maternal mortality. And yet we are not focusing on cervical cancer so much. There's been an emphasis on obstetric care. There's been lack of focus on gynecological care in terms of funding, research and training. And maybe now there's a time to elevate gynecological care as a global health priority. Just to tell you a little bit more about the EGS training, it's an 11-module course that covers a broad range of gynecological conditions, and you can see some of the ones up there. So it includes cervical cancer, abnormal uterine bleeding, urogynecology, etc. It has a human rights-based approach. It emphasises respectful care and evidence-based practice. It's a very interactive course, so it contains didactic lectures followed by interactive breakout sessions where there's skills training, communication skills training, case discussions, trying to look at attitudes towards care. And the target audience is very much the non-specialist healthcare provider. So there's an element of task shifting, which might be useful in humanitarian settings. And just to show you some of the documents I've used in preparing this presentation, you can see the MISP document there on the right and an adolescent sexual and reproductive health care toolkit on the left. And I thank you for listening.
Thank you, Dr. Ellison. Any question? We have room for one question only. Before. Yes? Can you give him the mic?
لك في حدا بده يعطيهم الميكروفون.
Where does the papilloma vaccine fall in this? Papilloma vaccine.
Thank you.
I think just in reply to the HPV vaccine, it's got potential. We could stop cervical cancer in the next few generations if we just vaccinated all the girls now. And